Hi, thanks so much for having me. I'm Kristen Carbone. I'm coming to you from Providence, Rhode Island. I am the CEO of a women's health startup and the mom of two teenagers. And I moved to Rhode Island about 12 years ago. And when I needed to find a primary care physician and couldn't, I reached out to a friend's mom who had been living in Rhode Island for decades. And she found me an OBGYN who I used as my primary care physician for probably the next 4 or 5 years until she retired. And then it took me like more than a dozen calls to find a new primary care physician who was accepting new patients, but also my insurance. And I adored her. She was wonderful and stayed with her until she moved out of state. And then it was the third time in a decade that I was looking for a primary care physician. And I really couldn't find one. I ended up talking to a friend who is like me in her 40s, but still sees a pediatrician. And she connected me to him, and he said he would happily see me in a pinch, like if I had a sinus infection, if I needed some support. But that's kind of as far as I went. And a little bit about me, I have Hashimoto's syndrome, which is an autoimmune disease that affects my thyroid. And it's really important for me to have a primary, as the woman who kind of impromptu kicked off this call mentioned. It's really important to have someone who's kind of overseeing the entire continuity of my care. And it's been really challenging because there's been so many changes. And as I also mentioned, I'm running a women's health startup, and I have a number of local physicians who are on my advisory board who also have been like unable to help me find a PCP. They've been great when I need a specialist and make good recommendations, but kind of just shrug when the PCP conversation comes up. And I think it really is absolutely critical for everyone to have access to a primary care physician. And I'm really excited about the work that everyone here is doing. So thank you so much, and thanks for having me.